Hello everyone and welcome back to our channel. Today we're diving into the world of medical diagnostics, focusing on the soluble transferrin receptor serum test. This test plays a crucial role in understanding your body's iron levels and can help diagnose various conditions. Let's get started. Pre-test information. Host. First things first, you'll be happy to know that no special preparation is required for this test. That means you can go about your normal routine without any dietary or medication restrictions before the test. Just show up at your scheduled time and you're good to go. Isn't that convenient? Unlike some other tests that require fasting or stopping certain medications, the sTfR test fits easily into your daily routine. Specification of the test. Host. Now, let's talk about what this test actually measures. The soluble transferrin receptor serum test quantifies the level of sTfR in your blood. Soluble transferrin receptors are proteins that provide insight into your body's iron status. Essentially, they indicate how much iron is available for your cells to use. This makes the sTfR test an invaluable tool in assessing iron deficiency and understanding whether your cells are getting enough iron. Diseases associated. Host. The sTfR test is particularly useful in diagnosing and differentiating between two types of anemia: iron deficiency anemia and anemia of chronic disease. These conditions can present similarly but require different approaches to treatment. IDA occurs when there's not enough iron in the body to produce hemoglobin, the protein in red blood cells that carries oxygen. ACD, on the other hand, is usually a result of chronic infections, inflammation, or other chronic illnesses. Differentiating between these two is crucial because it impacts the treatment plan. Specimen used. So, how is this test conducted? The specimen used for the sTfR test is a blood sample. A healthcare professional will draw a small amount of blood from your vein, usually from your arm. This sample is then sent to the lab for analysis. If you're concerned about the blood draw, rest assured it's a quick and relatively painless process. If you have any anxiety about it, don't hesitate to let the healthcare provider know. They can help make you more comfortable. Components included. In addition to measuring sTfR levels, the test often includes other components to give a comprehensive view of your iron status. These additional tests might measure iron, total iron binding capacity, and ferritin. These components together provide a full picture of your iron metabolism and help pinpoint any issues more accurately. Test report time. One of the great things about the sTfR test is the quick turnaround time. Test results are typically available within a few days. This means you won't have to wait long to get crucial information about your health. Quick results allow for prompt diagnosis and timely adjustments to your treatment plan if necessary. Detailed test information. Now, let's delve deeper into why this test is so valuable. The sTfR level in your blood serves as a marker of iron deficiency. It reflects the availability of iron for your cells. This is particularly important because, unlike ferritin, sTfR levels are not affected by acute-phase reactions or other conditions such as inflammation, chronic diseases, malignancy, or infections. Ferritin is commonly measured to assess iron deficiency. However, ferritin is also an acute-phase reactant, meaning it can be elevated due to various non-iron related factors like inflammation or chronic disease. This can sometimes lead to misleading results. In contrast, sTfR provides a clearer and more accurate picture because its levels remain stable regardless of these confounding conditions. Understanding this distinction is crucial. For example, if someone has a chronic inflammatory condition, their ferritin levels might be high even if they are iron deficient. The sTfR test can bypass this issue and provide a true reflection of their iron status. Importance of the sTfR test. So why is the sTfR test important in clinical practice? Well, it's particularly useful in cases where other tests might not give a clear picture. For instance, in patients with chronic diseases, infections, or inflammation, the sTfR test can help avoid misdiagnosis and ensure that iron deficiency is correctly identified and treated. Moreover, this test is also valuable in settings where iron deficiency might coexist with other conditions that affect iron metabolism, like in athletes or in individuals with certain genetic disorders. Step-by-step process of the test. Let's walk through the step-by-step process of getting an sTfR test. Consultation. Discuss your symptoms with your healthcare provider. They'll determine if the sTfR test is appropriate for you. Blood draw. Visit a clinic or lab where a healthcare professional will draw a blood sample. Laboratory analysis. Your blood sample is sent to a lab where they measure the sTfR level along with other iron-related parameters. Results. Your healthcare provider will review the results with you, usually within a few days. Follow up. Based on the results, your provider will discuss the next steps, whether it's further testing, dietary adjustments, or treatment plans. This process is straightforward and ensures that you get the accurate information needed to manage your health effectively. Real-life example. To give you a real-life perspective, let's consider a scenario. Sarah, a 35-year-old woman, has been feeling unusually tired and weak. Her doctor suspects she might have anemia. Traditional tests show her ferritin levels are high, but her symptoms persist. By conducting an sTfR test, her doctor discovers that despite the high ferritin, Sarah is actually iron deficient. This leads to a more accurate diagnosis and an effective treatment plan that finally helps Sarah feel better. Such examples highlight the practical utility of the sTfR test in ensuring accurate diagnosis and tailored treatments. Summary. In summary, the soluble transferrin receptor serum test is a vital tool for accurately diagnosing iron deficiency anemia and distinguishing it from anemia of chronic disease. It provides reliable results unaffected by various acute phase reactions, making it a superior choice in many clinical scenarios. Thank you for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe to our channel for more insights into medical tests and diagnostics. If you have any questions or topics you'd like us to cover, leave a comment below. Stay healthy and informed.